Williams on deck. Martha.
Look forward to that. And in the meantime, while the healthcare fight rages on in Washington, a very important question is popping up right now in many states. Does the federal government even have the right to make health insurance mandatory for you and for any American? A Minnesota state representative doesn't think so. He has launched the first legislative challenge to that, and he joins us now in America's Newsroom. Welcome, Congressman Tom Emmer. Good to have you here today, sir.
Thank you. It's State Representative Tom Emmer.
State Representative, good to have you here.
That's
Welcome,
right.
sir. So on what grounds do you think this whole Health Care Reform Act is unconstitutional?
Well, I tell you what, the reason I'm here is I've offered the Health Care Freedom Act in the state of Minnesota, which does two things. One, it would prevent the government from ever enacting a law that would affect your right or mine to select our own doctor and choose our own course of treatment. And two, it would prevent the government from ever passing a law that would penalize us for not following the government's program. And the question is,
go ahead.
The question is, if that becomes part of the Minnesota State Constitution, would that be constitutional? I believe it would.
Yeah, I mean, what you're setting up here basically is a future battle between your state and the federal government. If this health care reform passes, your state can say, no, actually in Minnesota, we have a law that says that you can't tell us that we have to have this kind of health insurance, right?
Well, actually, what it does is it says that the individual's right to make their own choices will trump any federal law or any state law. We have the problem, by the way, in Minnesota, we have a senator who's proposing socialized medicine here in Minnesota, and his goal is to eliminate all private insurance companies. So it's both a state rights issue and it's a local issue.
It's a fascinating way of going at this, State Representative. Talk to me a little bit about how it's going. Is there support for your legislation in Minnesota?
Well, there's support from the people. Absolutely. There seems to be a little rhetoric, though, and you just played some at the federal level. There seems to be a little rhetoric about who's right and who's wrong. The issue here is simply one of individual freedoms and liberties, and it's interesting because if you talk to constitutional experts at a federal level, they will tell you that the federal Constitution will trump anything like this. But then the question has to be asked, why do we even bother to have a state constitution if the federal Constitution, the U.S. Constitution, is going to trump anything we do at a state level? Yeah, it would be meaningless. We might as well get rid of the state constitution.
I mean, when you think about putting mandatory health insurance on people and saying you must have this, and the federal government, or the administration, I should say, would say, well, you can opt out of this plan, but you just have to pay a fine. What do you say to that?
I say that's outrageous. I mean, the federal government, first, if you look at the United States Constitution, there's nothing in the U.S. Constitution that provides the federal government with the authority to establish a health care system. More importantly, this country was based on individual liberties and freedoms, the right to make our own decisions, and especially when we're talking about health care, those decisions that are most important to us and our families, the ones that we believe are in the best interest of ourselves and our families. I don't think the government should be stepping in between us and our doctors.
You know, I'm sure that there's a lot of encouragement. You're giving people a lot of encouragement when you say this message and when you tell them that there might be the possibility that it's simply unlawful for someone to mandate whether or not you should have health care insurance. And there's also a similar effort going on in Arizona, I understand, and in Michigan as well. What is your sense of, of how much strength you might be able to build behind this movement?
Well, I think it's not just Arizona and Michigan. Actually, there are 10 states right now with similar proposals. I think what you're seeing across this country is you're seeing a revival of states' rights from the standpoint that when the federal government is literally moving towards making decisions for the people rather than people making decisions and the government doing its job, I mean, it's upside down. So you're seeing this wave that's starting where people are starting to stand up and say, I want to make my own decisions. I don't need government making them for me.
You know, one of the arguments for telling people that they have to have health insurance is that if they don't have it, there's a cost to that for the rest of society, that society has to cover them. It's similar in some ways to mandatory driver's insurance, that you can't get in a car and drive your car unless it's insured because of the cost that you might inflict on other people based on your actions. What about that parallel?
Well, it's a great example, and I understand what the arguments are, but frankly, mandatory auto insurance is a great example of why this will not work. We in Minnesota have something called the Minnesota No-Fault Act that requires everybody under penalty of law to have a certain kind of insurance on their automobiles. Guess what? we don't have 100% coverage. The sad part is we not only have people that don't have the coverage, they don't insure their vehicles. You can't force people to do something. Government would be better off creating the incentive for people to take care of themselves rather than threatening them, which I think this proposal last week even had a criminal penalty that might require jail time.
Yeah, I mean, it's going to be fascinating to see if what you're starting here and what's happening in other states across the nation ends up in the Supreme Court in a battle over whether or not you can actually force somebody to get health care insurance. Tom Emmer, thank you very much, sir, for joining us. Interesting argument.
Thank you for having me.